Cardiac cycle is the rhythmic contraction and relaxation of the heart muscles, which results in pressure changes in the atrium and the ventricles, leading to flow of blood throughout the body. Now, let us start in the beginning. The first phase is that of atrial and ventricular diastole. During this phase, the blood is returned to the heart through the inferior and superior vena cava and the pulmonary veins. Now, what happens here is that both your atria and ventricle are relaxed, and passively about 70 to 80% of the blood flows into the ventricles. So what are the pressure and volume changes happening here? Your obviously blood is flowing from an area of high pressure into low pressure. So your atrial pressure is greater than ventricular pressure and your AV valves are open. No blood is flowing from the ventricles into the great vessels, that is the aorta and the pulmonary arteries, because your semilunar valves are closed. So obviously your arterial pressure is greater than the ventricular pressure. Now this phase is followed by atrial systole. Now the atria start contracting to pump the remaining 20 to 30% of the blood into the ventricles. Now during this phase, the ventricles get filled up with blood. So the volume of blood in the ventricle will rise. Now, if you know if the volume of blood will increase, a liquid will increase in a chamber, the pressure of that chamber will rise. So throughout this phase, the ventricular pressure starts rising. And there will come a point when the ventricular pressure exceeds that of the atrial pressure, leading to closure of your AV valves with the lub sound or the S1 sound. However, still no blood is leaving the ventricles, so your semilunar valves are closed, and arterial and ventricular pressure, the arterial pressure is greater than the ventricular pressure. Now this is represented on the ECG by the P wave, which represents depolarization of the atria. Now this is followed by ventricular systole. Now, the first phase of ventricular systole is your isovolumetric contraction, which is there for only 0.05 seconds. Now, moment I say isovolumetric, I mean to talk about the volume of blood in the ventricles. Even though it is isovolumetric contraction, it is not the volume of ventricle. Volume is always spoken about in terms of the liquid. There is no change in the volume of the blood present in the ventricles. So that implies that both your AV valves and semilunar valves will be closed in this phase. And even though the ventricles continue to contract, the ventricular pressure will be greater than the atrial pressure. But because your semilunar valves are closed, your ventricular pressure will still not be greater than the pressure in the aorta and the pulmonary arteries. Now, there's also a slight difference in the pressure values in between the left and the right side of the heart. The left ventricular pressure is about 60 mmHg, whereas your aortic pressure is 80 mmHg during systole. And your right ventricular pressure is 7 mmHg, whereas your pulmonary artery pressure is 10 mmHg. Now, this short period of isovolumetric contraction is followed by opening of the semilunar valves, because the ventricular pressure is constantly increasing because of the systole. And moment your ventricular pressure becomes greater than your aortic and pulmonary artery pressure, your semilunar valves will open, leading to a rapid flow of blood from the ventricles into the great arteries. Now, this flow is initially rapid and gradually it becomes slow. So during this phase, your AV valves are closed because no blood is flowing from the atria into the ventricles, and your atrial pressure will be lower than that of the ventricular pressure. And this is represented in the ECG as the QRS wave. Also note that even though after pumping of blood into the great arteries, some amount of blood still remains at the end of ventricular systole, And this is known as your end systole volume. Now, after this phase, what happens is that because blood has gone into the aorta, so gradually your arterial pressure exceeds the ventricular pressure. And when it becomes higher than the ventricular pressure, your semilunar valves will close with a dub sound. That is your sound 2 or S2 of the heart sound. Now, this is immediately followed by a period of isovolumetric relaxation or isovolumetric diastole. And why isovolumetric? Because your semilunar valves are also closed and AV valves are also closed. So, once again, there's no change in the volume of blood present in the ventricles. And however, because the ventricles are in diastole, the ventricular pressure starts dropping. And once it becomes lower than the atrial pressure, your atrial valves will open. Now, this phase of ventricular diastole is represented by the T wave in the EKG. Now, moment your AV valves open, we once again reach the phase where we started, that of atrial and ventricular diastole. Now, this is what the complete cardiac cycle looks like. Have a look at this animation. I hope this video was helpful, and please like, subscribe and share, and let me know in the comments what would you like me to cover next, your pressure volume loops or